For this week case discussion, I selected a 12 years old male who presented with concern related to attention, hyperactivity, and anxiety. I found this case particularly challenging because correcting accurate data required input from multiple sources. For instance, from parent, patient, and school. And selecting the right assessment tool was essential for diagnostic clarity. For assessment tool, I used Vanderbilt ADHD, parent, and teacher scale, and the Scared Anxiety Screening tool. The funded build was appropriate because it validated for child or children aged between 6 to 12 years and provided symptom rating across both home and school environment, which is critical for ADHD since impairment must occur in more than one setting. The scanned tool was selected because it is sensitive to generalized anxiety symptom and help differentiate anxiety for ADHD related to restlessness. Together, these tools provided objective data that aligned with DSM-5 criteria. The relevant data supporting ADHD included difficulty sustaining attention, disability, and impulsivity and hyperactivity observed during the session. The Vanderbilt score were elevated in both parent and teacher report, which strengthened diagnostic confidence for anxiety. The patient endorsed excessive worry about school performance, nightmare rumination, and somatic complaint. His scanned scale was above the critical of, and his affect during the interview was anxious. So reflecting on the data correction process, I believe the cycle was appropriate and effective. I began with open-ended question to build the rapport, which helped the patient feel comfortable sharing his worry. I then incorporated parent collateral, which added content about symptom duration and functional impairment. Finally, I used standardized tool to validate subjective report. One challenging was maintaining the child attention during the interview. I addressed this by using short questions and allowing moment breaks, which improve accuracy of information gathered. So overall, the combination of subjective data, objective observation, and validated assessment tools allowed me to construct a clear and diagnostic picture. The case involves the importance of informant data collection in pediatric psychiatry, and I highlighted how the structured tools can improve diagnostic accuracy and efficiency. Thank you very much for watching.